Hello, dear friends. I'm Dr. Ilango Sethu, liver transplant surgeon at the Royal Care Super Specialty Hospital at Coimbatore. Today, I am here to discuss with you why you need a liver transplantation as a part of your treatment. Your doctor has referred you to us for consideration of a liver transplantation, and I want you to understand why we are doing this procedure as a part of your treatment at this point in time. You see, the liver is a very wonderful organ. It manages all the biochemical reactions in the body. It manages all digestive process. It stores energy in the body and performs toxin removal in the body. It is a very, very vital organ. At this point in time, whenever there is a liver disease from any condition, either it is from alcohol or fatty liver or from viral diseases or any other condition that can lead to liver damage, you reach a point called cirrhosis when the liver is completely scarred. When we call cirrhosis, we still mean that the liver has not had any impact on your other body systems. There is a point in time this character changes to something called decompensated chronic liver disease. This is the point in which you will be suggested that to consider liver transplantation as one of your main treatments. Now, when do you say that you have reached this point in your treatment plan? So, you will notice that fluid starts accumulating inside your body. Medically, we call this ascites. Initially, we can manage this fluid collection inside your belly by using water pills, diuretic tablets. After some time, the doctor keeps on increasing the dose of diuretic tablets with less responses. At this point of time, you will need regular tapping of the fluid and you will also need albumin infusion. These two indicate that the ascites has become refractory, not adequate response to treatment. At this point in time, liver transplantation is a life-saving method. A person with refractory ascites has a very high chance of dying in the next 1 year of life. So, when a patient reaches refractory ascites, we suggest liver transplantation as one of the key treatments. The second complication that happens in a patient with refractory ascites is infection of the fluid inside the belly. We call this spontaneous bacterial peritonitis. Spontaneous bacterial peritonitis, even one episode of infection can increase the risk of dying from the liver disease to very high levels. So these are very, very important complications. The worst complication that can occur from fluid inside your belly is a derangement of your kidney function, a hepatorenal syndrome. So these are the things which indicate that you must register yourself for transplantation at this point in time. The next complication which you may be presenting with is variceal bleeding. A simple variceal bleeding, a blood vomiting, either you vomit out red blood or you pass black colored motion. Both of these things indicate that you are bleeding inside the intestinal tract. So these are immediate life-threatening circumstances, but most of the time your doctor will be able to perform control of the bleeding with endoscopy or other means. The presence of a single episode of bleeding means that your pressure inside the liver because of the scarring has gone to a certain extent. Usually we call this clinically significant portal hypertension, beyond which transplant will become a real option for treatment. We usually do not transplant patient with isolated variceal bleeding. We also look for whether the liver function has started deteriorating. The third key problem that you will face in a patient when the liver disease becomes very severe is hepatopulmonary syndrome. This happens when the oxygen level is lowered in your body because there are large dilated blood vessels in the lungs that bypass the oxygen, and that is also another indication. Next indication which you must know is brain fogginess, which we call hepatic encephalopathy. The liver has a major function of clearing all the toxins. The most common of which we assess is ammonia levels. If the ammonia level goes up because some certain functions of clearing ammonia is not working, so this can cloud your brain function. Initially, it look like small confusion, your sleep pattern may be altered, but it can worsen to as bad as going towards coma. A single episode of hepatic encephalopathy is enough for you to need liver transplantation. It shows you that your liver is no longer capable of clearing all the toxins in the body. A simple way of understanding whether your liver has become very much damaged is to use something what we call as the MELD score. The MELD score is a composite score consisting of bilirubin, your coagulation parameters called the INR, and the creatinine value. This has been used in the world for several years, and a MELD score of more than 15 indicates that the benefits of liver transplantation for you far exceed the risks of liver transplantation. This is the point at which we always tell you that you must register for liver transplantation. There are several medical studies that tell you that if you register for a liver transplant at this point, the benefits of early recovery, a good surgery, and a return back to normal life is very high in this situation. Sometimes you may be presenting a little later. We still will do liver transplantation, and the benefits still outweigh the risks. So do not worry. Whenever your MELD score goes above 15, you must consider liver transplantation as the curative option. At this point in time, if you know all these facts, we believe that you will be able to make a more informed decision. Finally, for closing, I would say that liver transplantation is not just an operation. It offers you a second chance at life from a very uncertain, always hospital-dependent life with the risk of death always hanging above your head to a stable, healthy, predictable life that will help you return back to normalcy. So consider liver transplantation at the time when you really need it, because it offers you the best chance of surviving your liver disease. Thank you.